Hi, everyone. Welcome to the 2019 Brain Health Online Summit. I'm Amy Zellmer, founder of Faces of TBI, and myself, along with Dr. Jeremy Schmo from Midwest Functional Neurology Center, we saw a need in the brain injury community for more training and education on alternative healthcare methods and modalities for those suffering from the lingering effects of a brain injury. So each week during the month of March, you are going to hear from a presenter who will share either their experience living with a brain injury or working with patients. So today I am here with Dr. Kassie Kaas, and she earned her Bachelor of Science in Biochemistry and Molecular Biology from the University of Minnesota Duluth, where she graduated with honors. After graduating, she spent a year with AmeriCorps developing a community-based health and wellness program in rural West Virginia. While completing this project, she decided that chiropractic care was how she wanted to help people recover from their chronic health issues and achieve a better quality of life. She earned her doctorate in chiropractic degree from Northwestern Health Sciences University, graduating with cum laude honors. During her time in chiropractic college, she discovered the unique and challenging specialization of functional neurology. She has since completed over 1,000 additional hours of focused study in the area of functional neurology, as well as applied kinesiology, pediatric care, nutrition, and functional medicine. She is also currently receiving specialized training in the Bredesen protocol from the Institute of Functional Medicine and looks forward to applying this knowledge to helping patients recover from and reverse cognitive decline. She is an associate doctor at Midwest Functional Neurology, where she loves applying her knowledge and helping patients heal from various chronic health conditions and forms of brain injury. So welcome to the summit, Kassie.
Hi, thank you so much for having me.
This is very exciting. I have known Kassie since she was an intern for Dr. Schmo. So we spent a lot of quality time together during my intensive.
Yes.
So today I'm really thrilled that you're going to be talking about brain fog. And, this is a term I hear. I would say 98.9% of the people who have a brain injury complain of brain fog. And it's one of those really ambiguous terms. Like, it can kind of mean something different to different people. So I think this will be a really fun subject to jump into. So, why don't you kind of jump in and tell us, what you think of when you hear patients talk about brain fog?
Yeah, so the things I hear the most from like the patient experience as far as brain fog and what they're experiencing, what they're going through, a lot of times it's anything from, they feel like they're more forgetful, they can't find their words, they feel like they mix up things, people, places, memories. It's just all basically their cognitive function just feels slowed down to them. And I think that in turn can really play into like not only how you feel about yourself, but how you function in your life on a day-to-day basis. And I think it's really one of those things can, it just seems like it should be nothing, but it can really disrupt your daily life. And then you compound that with the fact that a lot of times, if that's just the last and lingering symptom after all the bumps, bruises, any scarring is healed, you on top of that have to deal with the whole, you look fine paradox. And you have to deal with the runaround from, your friends, your family, other providers who just don't understand what you're trying to communicate and don't understand why you can't just get over it.
Right.
I know you probably had some experience with that.
Mm-hmm. Yeah. The whole, well, you look fine and, you're out doing things, so you must be fine. You're a Target. What do you mean you're still struggling? Yeah.
And it's the fact that you can do those little tasks and things like that, and some days are better than others, but sometimes you'll go out and do something and it'll put you down for 3 days.
Yes.
And just your function won't even be there, and it's just really hard, and it gets harder over time as these recovery periods get longer and longer and longer. So yeah, the patients coming in here that I tend to see have, unfortunately dealt with the whole you look fine they've seen multiple other providers, and commonalities are, they'll get put on different medications, ones to help them with focus, but then they'll need ones to help them sleep. Eventually, they'll probably come in contact with some antidepressants just to deal with the emotionality of it. And try and make them feel more like themselves or like they did pre-brain injury. But in my experience, I haven't seen that help people very much. I know that's probably like a little bit of your story and a little bit what you went through.
Mm-hmm. And, I never actually took any of them. They wanted to put me on them, but I said no. Because here, my thinking, when the doctor told me she wanted to give me Ritalin, antidepressant, and a sleeping pill. And my mind was like, how is that going to help my brain injury? And I already know that an antidepressant is basically, it changes the chemistry in your brain. Well, I'm trying to heal that chemistry, so I couldn't comprehend why they even wanted to put me on it, right? And I would have to believe that to some extent these medications can cause brain fog.
Yeah, we've seen that as a side effect. Different medications will cause different side effects that won't agree with you, and they can increase brain fog, and they can increase other symptoms as well, and even present new symptoms that you didn't have prior to the brain fog. So even if your cognitive stuff clears up a little bit, now you've got other things you have to deal with, like maybe disrupted sleep patterns, or something's made you dizzy or dizzier, something like that. So it's just kind of like this vicious cycle. So what I'm excited that we do here is we actually really truly evaluate the patient. Don't take brain fog lightly. I consider it a pretty serious symptom. And even if it's the last and only symptom that a patient presents with, I take it just as seriously as anything else, any vertigo they might have, balance problems, dizziness, any of that. And so what we're able to do is just really kind of nitpick the circuitry, get down to, what's firing correctly, what's not, is there inflammation going on, and kind of look and see, well, why do you have this brain fog, or what's going on, and what can we make better, and how can we get it to clear out?
Yeah. Yeah. I know for me, when we finally were able to clear up the brain fog, it just opened the door for everything else to start healing. It was sort of like a domino effect. Like, we cleared up my vision stuff and the dizziness, and that helped relieve the brain fog. And then then the cognitive processing got faster, then the memory came back. I mean, it was like a really cool, it didn't happen overnight. It took time, but it was like really cool to acknowledge those things as they happen. Cause I could see those changes myself.
Yeah, and that's a really exciting thing. And it's a really exciting thing to work with a patient for sometimes only a couple days and to really see this turnaround. But it's when you're actually able to get in there and evaluate what's going on, and patch up that really specific circuitry, then you can make those changes rather than just trying for a global effect of a medication or a more broad therapy protocol, so to speak. So the way we're able to do that is just with a really good focused exam. And I love the way we examine the things we do, because a lot of times we're able to pull out things with the patient that they didn't even know were off. Kind of like how about you talk with your eyes, you didn't know exactly what was going on. You knew something was wrong, but you didn't know exactly what it was. Find stuff like balance in certain positions is off. When you're trying to do coordinated movements on both sides of your body, one side's off. When you try and touch your nose with your eyes closed, sometimes that can be off on one side. So we'll pick out all these other little things, because with brain fog, a lot of times it's not one specific area that's affected. It's pretty global. It's a lot of different things, and a lot of different areas and circuitries play into that. Once you start addressing them piece by piece and all together, you can start making some really good changes.
So what are some of the things that can cause brain fog? Like, where are some of those symptoms likely coming from?
Yeah, so a lot of times it's not necessarily exactly like where the damage occurred. So it's not like, oh, I hit the back of my head, so all of my symptoms are going to be related to the part of my brain that's in the back, or I hit the side, so it's going to be all this side symptoms. A lot of what we see is just kind of global inflammation. And that can be a big word in and of itself too. It's kind of like brain fog itself. Well, what exactly does inflammation mean and what does it do to brain function? And the way I like to explain it is you have these cells called microglia in your brain, and part of their job is to help like clean up debris, be like the immune part of your cell, keep the dirt and stuff out and just keep things functioning normally. Well, in inflammation, sometimes they can get overactivated or like overprimed and they can just start acting abnormally. So it's the same thing I would say, like if you were cleaning your house and you have different rooms in your house, like different lobes in your brain, but they all kind of come together to make a house, even though they have slightly different functions here and there. Well, if you're trying to clean your house and keep it clean and protected, and you see a little dust bunny, and you're like, oh, that doesn't belong there. So I'm going to go clean it up. But instead of taking like a tissue or a Swiffer or something, you take out an AK-47 and all that dust bunny away. So it's kind of like overreacting. And not just that dust bunny, now you start seeing like, oh, there's a shadow over there in the corner. And so you go after that as well. And then you decide to invite 5 of your friends over to your house cleaning party. And so imagine that going on in your brain, just inflammation base wise, like this chronic pro-inflammatory vicious cycle. And it's not going to be good for healing. It's not going to be good for surgery, and it's only going to make things worse. So what you have to do is find ways to either calm down that inflammation, remove things that are pro-inflammatory, and introduce things that will calm it down. And
So what are some of the things we can do or you can do to help calm down that inflammation and brain fog?
yeah, absolutely. You can work with your metabolic system. So nutrition wise, you can introduce different like antioxidants like glutathione, different flavonoids like curcumin, turmeric, that kind of thing. Those are all very anti-inflammatory. But you can also remove like drivers of inflammation. And I'd say common drivers of inflammation are obviously going to be diet. If you do like a lot of sugar, that's very pro-inflammatory. It's in a lot of processed foods. If you develop food sensitivities, which is very common after brain injuries, so then you keep eating foods that you're reacting to, and that just kind of compounds the vicious cycle of inflammation. Otherwise, we have like a compromised GI system. I think you've talked a little bit about that before, leaky gut. A lot of times if you have leaky gut, you have leaky brain, and that's just going to be more cyclical inflammation going on. And that mixed with the food sensitivities, that's common in a lot of patients where you hear the story of, I ate something and then all of a sudden like I was really foggy or I was really sleepy after
Yeah.
that. That's where that kind of stuff presents itself. So just like with the GI system as well, it's not always as if you eat something that's pro-inflammatory and there's like pain or something. Sometimes it's just fog. That's your symptom. Just like the brain doesn't necessarily have any pain fibers. So when it's swollen and hurting, it's not going to feel pain. It's going to feel like foggy or slowed down or just cognitively not all there and not firing like it usually does.
Yeah. Yeah. I think, that whole food thing, like after you eat certain foods and people feel just, tired, they think it's just a food coma, but, it's probably some type of a sensitivity.
Yep, because that's not normal. Like after you eat, you shouldn't necessarily feel overly tired or over sleepy or sluggish or anything. You should just feel like you've eaten. So no reactions one way or the other. So that's why we look so closely at nutrition sometimes with people, because sometimes it's not necessarily simple, but what you have to do is remove these pro-inflammatory things.
Yeah, I think we've talked about that in a few of these interviews about how you really have to address the metabolic, and if you have underlying metabolic problems, you're not able to heal the brain.
That's very, very true. Another way that plays into it is I can get a talk on dysautonomia. So your brain also needs, in addition to, not having the introduction of pro-inflammatory items, you have to have the ability to have like oxygen and nutrients and clear away basically the garbage. And what's going to do that is your circulation or your blood flow. So you definitely need proper blood flow to your brain to help with the healing process. And that blood needs to have, be carrying the proper nutrients, fuel for your brain, enough oxygen, and that's what's going to help that heal. So that's why it's so important to look at any underlying like autonomic issues that can happen after brain injury.
So if someone comes in and you've gotten their nutrition under control, what are some of the next steps in dealing with brain fog?
Yeah, so some of the next steps then would be to really assess what's going on circuitry wise. And the way we can do that is we obviously look at eye movements, the eyes being the windows to the brain, so to speak.
Mm-hmm.
So there, when they're not functioning, that can give us a clue as to different areas of the brain that aren't functioning, and then we can work on the specific circuitry of that. That also can play into if the eye movements themselves are not coordinated or not happening like they should, sometimes your processing is going to be off. Easiest way to explain that is like with your quick eye movements, your saccades. If you're not generating these quick eye movements or these saccades, a lot of times when patients, when that's off, the feedback I hear from their experiences, these would be the patients who they read something, and by the time they were to the next page or in the middle of the next page, they'd forgotten what they'd read on the first page.
Yep.
When they're walking around in their visual world, like their visual spatial things can be off. So those are also people who are like bumping into doors and other people. So that's why we take so much time to assess the eyes, the circuitry, how they move together, and if they're giving proper feedback back to your brain so that you can deal with your environment.
And so what about addressing, these people that come in and they have not only a brain injury, but they have a lot of physical injuries too? How do you balance that treatment plan?
Yeah, that's going to be a mixture of both. Obviously, not necessarily one geared more towards the other or not, because both are really important, and you need everything functioning together to get probably the best chance of healing. But sometimes it does end up being you have to work with the autonomics first. You really have to get people stable and breathing and getting blood up to their brain. Otherwise, therapies are just going to like tire them out and be more taxing than they should be. But once those are stable, then we can go in and start working on basic circuitries. And that can be through eye movements. We have a lot of different cognitive and neurospecific modalities that we can use, like the NSI board, the neurosensory motor integrator. So there we can incorporate different pathways, different circuitries, all in one piece of equipment. Same with like the D2 Dynavision board. There we can get people moving their eyes quickly and then responding with body parts. Can make it really, really challenging cognitively wise. So we mix that in too once everything else is a little more stable. And then that just allows us to be able to work more and more with the physicality of things.
And what, someone who's had a brain injury and, it's been 10 years and they're still experiencing brain fog and other symptoms, we know about neuroplasticity now. And what kind of success have you seen with patients that are further out in their recovery and helping them get better?
Yeah, I would say we've had the same amount of success with someone who's 10 years post-injury as 5 years, as 2 years, as 6 months. I don't see any like limitation time-wise where, you've had this injury X number of years, there's nothing we can do for you kind of thing. I know a lot of our patients have heard that from other providers, and their care has been geared more towards, living and coping with their new normal, so to speak. But in my mind, with neuroplasticity and the way we're able to assess patients, we can see changes far, far out from injury.
And what about, further cognitive decline? So, there's a lot of talk with CTE and Parkinson's, Alzheimer's, dementia. I've heard so many statistics thrown around out there that I don't know what to believe. And they're usually not cited. So you don't even know who to go look it up for. But, what are you learning with the correlation between brain injury and further cognitive decline?
Yeah, From research I've done, there is typically a positive correlation, meaning that if you sustain a traumatic brain injury, your chances, and different papers cite different numbers. I've read, 2 to 4-fold increase. I've read an 80% increase in chance, basically of in later in life developing something like dementia, another neurodegenerative disease, Alzheimer's, cognitive decline. But in essence, that is a difficult study to do because you can't really take a group of people, give them a brain injury, not treat it, see if
Right.
give another group of brain injury, treat it, see if they do any better kind of thing. So a lot of it's, longitudinal studies looking, back at what happened to patients who did sustain brain injuries.
Right. So,
But
that's kind of where I was going to go with that is, in the past, until very recently, we didn't know about neuroplasticity. And therefore people, kind of gave up on the recoveries, or there was no treatment. And now we know that we can get people better. So in your opinion, if we're getting people better, do you think they have a less likelihood of developing further cognitive decline, or do you still think they'd be on that same trajectory?
I would like to say that after receiving treatment, I think you would decrease your chances of later developing cognitive decline. And part of our program here and what we emphasize is after receiving treatment, it's not necessarily like you're done, goodbye, there's nothing
Yeah.
more you can do. Neuroplasticity is an ongoing thing. So we always send patients home with really specific home rehab exercises to do, and whether they end up doing them for 3 months, 6 months, a year, it all kind of depends, but trying to emphasize that there's no shortage of things you can do on your own and at home to keep you going in this positive direction.
Mm-hmm. Yeah. I mean, I still do mine. If I'm having really bad days, I will dig out all my stuff and start doing mine. And
Right.
it helps, I notice it helps sooner than, you know what I mean? I don't have to do it as long. I'm going to only have to do it one time and I feel better. Um, so I think neuroplasticity is really cool. But
And hopefully people will understand that it's not just the exercises too, it's you can remove the pro-inflammatory foods. I feel like we know way more about what we should be putting into our bodies these days than we used to. Also, as far as with supplementation, that you can start doing it proactively instead of until your memory is a little shoddy. You can't remember where your keys are all the time or why you walked into a room. You can start before that and start loading up on some of these things like a multivitamin, basically to help keep your neuroplasticity workable and going.
yeah, so a friend of mine, his boss, very recently, like a week ago, he fell and hit his head on the bottom step. And he, for the past 2 or 3 years, he's been doing the keto diet and he does a lot of supplementation. And I'm like, it's going to be interesting to see what kind of symptoms he develops, because I feel like without trying, he was doing it for just his lifestyle, but without trying, he was being proactive in his brain health, right?
Mm-hmm.
So it's going to be interesting to see how that changes, because I mean, he blacked out. He hit it pretty hard. So I think there's, we've had Dr. Michael Lewis on the summit the past couple of years talking, about fish oil and being proactive. So even after a brain injury, if you continue being proactive with the diet and supplementation, God forbid you hit your head again, hopefully this will help protect your brain from the next one.
Exactly. And I love people being proactive. I mean, typically, most of us take pretty good care of our cars. We give them gas when they need it. We give them oil changes and tire rotations. Why? Because they're important. They get us from point A to point B. But our brains, that's everything. I think to a lot of people, that's everything. So I feel
Yeah.
like we get at least the same consideration for our brains that we would for our cars.
Yeah, I've always thought that's a great analogy. You think nothing of spending $100 every couple months for your oil change and tire rotation, maybe some wiper blades.
Mm-hmm.
But oh gosh, $100 a month on my supplements? No, that's expensive. Yeah.
Mm-hmm.
Which
Exactly.
is actually more important?
I would have to agree. Yeah, definitely.
Yeah. So, Kassie, what else did I feel like I skipped something. What was there anything else that you specifically want to talk about with brain fog?
Um, just that I guess it is an important symptom for
Yeah,
people. I feel a lot of times like patients will come in with an MRI or CT or something like that, and it's been marked clear. It's within
right.
normal limits. It's fine, but they're still dealing with symptoms, and I don't take that lightly. I don't think it's any small thing, and um, basically just want them to know that there is help and there is hope. If you find providers who will take a critical look at you and see what's going on, and then have the skill and know-how to help kind of heal these circuits and help you keep going, and then give you opportunities to keep it going once you get home and out of treatment, um, especially with measurable objectives. I think that's the best route to go.
Yeah. And I think you triggered me. What I was going to say was, people with brain fog, like if that's maybe their only symptom and, maybe they're able to work and they're able to do their activities but they just, they don't have a headache, but they don't really have any other major symptoms, but just this fog, like this. And I always said it felt like my head was just full. Like when you have a really bad head cold and your
Mhm.
head just feels kind of full and it like it's full of stuffing in your head or something, that's how it always felt.
Mhm.
And that in itself is a pretty major symptom. And like I said, I think like 98% of people with a brain injury will say they have brain fog. But don't take it so lightly. I think so many people think, well, if this is all, then if this is the only symptom I have, then I can deal with it. I'm fine. Well, no, we can help get rid of that. So
Exactly. And I mean, I've heard it explained exactly how you explained it. I've even heard them say, like, if you've ever seen that Claritin commercial where
yes.
it's like all foggy and gray, and then they take this medication and it's all bright and clear and everything like that. Like, honestly, there probably isn't any magic like supplement or one dietary thing that's going to lift that veil for you, but you need someone who can pare it down to say if it's more nutrition or if it's more neurocircuitry, or do we drive this pathway versus another pathway, and just kind of make it very specific and tailor made to you. Because yeah, at the end of the day, brain fog might be your only symptom, but it's affecting your whole life.
Right.
School age children, it might be, the difference between passing a class or not passing a class. Eventually, it might be the difference between, getting a promotion or getting demoted because you just can't function in your role anymore. Even so far as, can you drive your car? Can you live independently? Um, it's pretty important driving factor. So yeah, even if it's only your one symptom and everything else seems fine to you, which chances are during an exam, we'll be able to pull out some other things that are
Yeah.
not fine. But even if that's the only known symptom to you, it's a big deal, and should definitely not take it lightly and take care of yourself.
Mhm. I agree. Well, Dr. Kassie, thank you so much for being here. I think this is such a perfect topic because I think it's a term that pretty much everyone can relate to. And even with someone without a brain injury, I think they can sort of relate to the term too. And another description, I just have one more thought about that. Another description that I used a lot was I felt like I had a hangover. Like most adults can relate to what a hangover feels like. And it felt like a hangover, like I'd had too much red wine and I woke up in the morning, but like I feel like that all the time and without drinking.
Mm-hmm. Mm-hmm. Yep, I've heard that one before, and it's not a good way to live your life.
No, nobody likes a hangover.
No, definitely not.
Well, Dr. Kassie, thank you for being here. This was a great topic, and I really appreciate you taking the time to share with our listeners.
Yeah, thank you so much for including me. I really appreciate it.
Yeah, and thank you everyone for watching, and we'll see you in the next episode.